Hello and welcome to the Before We Agree to Surgery series. This is a space where we pause before making surgical decisions and try to understand what options may exist. And today we have with us a very special guest, Dr. Abishek Bansal from Delhi, one of the senior and highly respected interventional radiologists with extensive experience in treating several complex conditions through interventional radiology. Doctor, thank you so much for taking the time to join us today.
Yeah, thank you so much, Sumita, for having me here. And it's a topic that's really close to my heart. And I think that is something that's really going to help patients a lot. And I think this is a great initiative where we are bringing this information to the masses so that they are able to choose better. And before they commit themselves to a surgery, they know that there's an additional option that can be much, much easier for them also.
Yeah, so today we are going to talk about something that many people hesitate to discuss openly. Varicocele, a condition that can be associated with scrotal discomfort as well as male infertility.
Right.
So, doctor, many men either ignore symptoms like scrotal discomfort or heaviness, or they discover this varicocele only when they start facing fertility issues.
Right.
Why do you think men remain unaware about this condition?
So that's a very pertinent topic. And I think as men, especially as Indian men, we have been taught to project our macho image in front of the whole world. And I think so that's where I think men seek less of medical attention, especially when it comes to reproductive organs like scrotum and inguinal area. I think there's that taboo in our country that they feel hesitant to discuss about it because they feel that if they are suffering from a problem and they talk about it to their friends, to family, they may kind of make fun of it. So that's, I think, one of the biggest hindrances that Indian men, I feel, and I will take you to this very famous thing that comes in Bollywood movies, कि मर्द को दर्द नहीं होता है. So means कि males don't feel pain, but I think we have to change that
True.
notion. I think it is something, as we say in medicine, the earlier you seek attention, the better the treatment outcomes will be. So I think we need to create awareness about this, that dull, aching scrotal pain or scrotal swelling are symptoms that men should get themselves tested for. We are not saying that everybody would need treatment, but this is something that they need to show to a doctor, get an ultrasound done, and then take it forward.
Absolutely right, doctor. So, for many of us who do not understand it, can you explain in very simple terms what varicocele is and how common it is among men?
Right. So I would say that varicocele is nothing but people would know about varicose veins, where veins on the legs bulge. So varicocele is nothing but varicose veins of the testes, or what we say scrotum. So the veins that is draining our testes, and so veins have a work of carrying blood back to the heart. So whenever the veins draining the testis, they get swollen for many reasons that will come on to shortly. Whenever they get swollen, they cause edema or swelling of the scrotal region, and that is the commonest thing. And normally it presents as dull aching pain, especially after prolonged standing, after long working day, because that is where the veins have to carry blood against gravity. So whenever that happens, long term standing or prolonged heavy working day, these veins tend to swell up more and cause more edema in the scrotal region. That is why causing dull aching pain. It is a very common condition and almost affects 20% of the males of reproductive age group. But again, not many of them seek medical attention. It's kind of not given a thought, or not really. There's a common concept that, okay, maybe it will disappear on their own. But as
Mhm.
varicocele is neglected, it just worsens with time.
Okay, so what symptoms are we supposed to look for, or is it silent, or men can actually feel certain symptoms which they are not aware about?
Right. So in the early stages, it is still silent, but gradually, men, I think the signs and symptoms to watch out for are dull, aching pain, especially after prolonged standing or towards the end of the day. Apart from that, whenever a gentleman is feeling the testicular area, they may feel a feeling what we call as bag of worms. Bag of worms is nothing but, I mean, to listen to it feels a bit gruesome. But again, what it just depicts is that you feel these dilated veins along the testicles, and you will feel that something is swollen up or dilated. So that's one of the earliest things that men can actually start whenever they feel this dull aching pain, they can try to feel their scrotal area. And if they feel this bag of worms thing, I think that's a sign that you should seek medical attention.
Oh, that's something which is very useful, doctor. So once they get to know that, yes, I've been diagnosed with varicocele, so the immediate thing which comes to mind is now I have to, go through this surgery. So before we agree to surgery, what is that one important thing a patient should know or keep in mind?
Right. That's a very important question. To be honest, varicocele is not a medical emergency. There's nothing to be afraid about. Okay, I've got diagnosed with varicocele. What will happen? Trust me, majority of these people will may not have any symptoms except for the dull aching pain. So what we look for before treating varicocele, if you have a dull aching pain that is disturbing your normal lifestyle, and if you're trying to conceive and are not able to conceive, and then we look at it because we know that varicocele have some effect on sperm quality and sperm count. So if problems in conception are happening, or you have a dull aching pain that is making your life a bit difficult, so these are the two indications when we want to treat varicocele. When I was doing my MBBS many years back, more than 2 decades back, we were all taught that surgery is the only option for varicocele. Rather, that
True.
used to come into our surgical examinations as a final exam MBBS graduate. But I'll tell you, medical science has moved away. Even in surgery, there was open surgery, then laparoscopic, then robotic. So now we have a very good interventional radiological alternative to varicocele treatment that is safer, less invasive, no scar, much more effective. So all advantages. If you go to compare surgery with interventional radiological management of varicocele, it will score head on as compared to surgical option.
Okay, I'm sure the patients, whoever is watching this video would be very curious to know what is this all about. So we want you to, help us explain in little layman terms, what is this varicocele embolization which you're talking about, and how different and what would be the advantages compared to the traditional surgery method?
So, as I was mentioning about interventional radiological management of varicocele, so we call it varicocele embolization. The name may seem a bit longer or a long one or a fancy name, but it is a very easy procedure. What we do is we just use a local anesthesia to make your skin numb, and we use a very fine needle like a pencil tip, and a wire. We go through the neck vein or through the vein in the groin, and there is no cut involved, no general anesthesia required. We just make the skin numb where we want to go into the vein, and we go inside the vein. And what we do now is that you're traveling inside the vein like a boat would travel in a river, and you reach the desired site of the varicocele. By varicocele, if you would remember, I've mentioned about dilated veins in the testis. So we reach where we want to go actually, and then we start blocking that vein from inside. So this is the difference. So in surgery, normally the surgeon would give you a cut at the scrotal region, and then they would separate the areas. They will do a surgical dissection, and then they will ligate or clip the veins that is causing the dilatation of the veins. So they can only clip or ligate what they are seeing directly through their eyes. Sometimes body has a way that, just like on highways, you have a main highway, then you have a parallel highway as well. Similarly, body can have these parallel venous channels. So that is the biggest disadvantage of surgery, that whatever you see, you only cut those. But sometimes a parallel channel may get left behind, and which can actually cause recurrence of varicocele. Whereas through embolization, if you would remember, I told you, we are coming inside from the vein, and once you are coming from inside, you will see all those venous channels, be it one, two, three, four, whatever number of channels are there in the body, you see it. And once you block from inside, you've actually taken care of that dilated vein without any cut, without any surgery, no bad scar at your scrotal region, no more questions regarding whenever a lot of young gentlemen who have these medical examinations and they get rejected because of varicocele or surgical scars. So that thing is also taken care of. And more importantly is that dull aching pain is gone immediately after the procedure. The impact on the sperm quality starts to happen immediately. Obviously, it takes some time because the previous reservoir has to empty out. and you can go back home the same day with only just a
Wow.
simple bandage on your neck. That's it.
Wow, doctor, you actually made it so simple. Otherwise, patients, when they think about surgery, first of all, the word surgery itself scares them. And then
Yeah.
it's quite a sensitive area, and to have cuts, can't imagine the amount of pain and the post care which they need to go through. And you also, when rightly said, army, because it's a very important check these men go through when they have to join
Right.
the army. So,
Right.
this embolization procedure, if they get this done, so there is no cut, there's no stitches, as you rightly say. So, is it going to be easy for them to join back for the army?
Absolutely. A lot of young men do come to us, and some of them have actually failed their medical examinations after a surgery. And then they actually, somebody at the medical examination center only tells them that you get a embolization done, which is better than surgery. And we have tackled so many actually, I would say men or young children who have come to us post surgery with recurrence, and once we have embolized it and they've got their medical cleared, and almost every month or so we get these sweets from these young cadets who get selected for the
That's so
military and the
sweet.
paramilitary services. They're just so happy because I think, and then they always tell us, Ki, oh, why did I go for surgery in the first occasion?
Absolutely. But how does one know that, am I the right candidate for this procedure? Do I have to
Right.
keep certain
So
things
I think
in
that's a
mind?
Sure. So that is a very important question. I will want to elaborate on that in the sense that you have to make a note of your symptoms. Uh, does a dull aching pain is impacting your life? And if you're a married person, are you able to conceive? How you're planning your family? After these two considerations, if we feel that varicocele needs to be treated, so the first step is to get a ultrasound Doppler done. That is a very basic test done by any radiologist that you want to approach, and they will just do a 15-minute scan ultrasound and Doppler that will actually categorize the varicocele into different categories, into different grading, what we say grade 1, 2, 3, 4. And depending upon that grading, we can advise treatment. So, grade 1 is something where we still feel that with a good tight scrotal support, good lifestyle management, we can postpone the treatment for some time. But grade 2 and beyond, I think if the symptoms are there, it is causing you dull aching pain, impacting a lifestyle, or having that infertility issues. So that is when we want to treat urgently, or not urgently. I mean, that is where we want to treat you so that you are able to do away with all these problems of yours.
As you rightly mentioned, when you mentioned about the grades, no, doctor, what we also realize is when it starts, we generally say it's, I don't know, first of all, it's a varicocele which I'm going through. So I feel, okay, let me
Right.
just manage. This pain might be, it's something related to, I don't know what, but I can still manage, is what many of them think. And they generally
Right.
let them grow it from grade 1 to grade 2 or grade 3, and that's when they come. So what would
Right.
you
Very true.
suggest to these men who just thinks like, okay, fine, let me wait,
Right.
because I feel
So
it's not a
I
right
would
decision.
I totally agree with that, and I think as I said in the beginning, I think there is no shame in seeking medical attention. So I think as men, we have to do away with that stigma of being a Superman sort of a guy who doesn't feel anything and I can take care of everything. I think if a dull aching pain starts in your testes and that is bothering you for more than I would say 2 to 3 days, and there is no history of any trauma, I think there is no harm in seeking medical attention. I think the starting point maybe go to a radiologist, get an ultrasound done. It is a absolutely safe test, no harmful radiation, nothing, and that would characteristically identify what the problem is. And if varicocele is there, by neglecting a grade 1 varicocele, we're only making things worse because sooner or later it will turn into grade 2, 3, and the bigger the grade is, the bigger the problem is.
Absolutely, doctor. And since you also mentioned fertility, I
Right.
wanted to check. Uh, Many men get to know about varicocele only when they start getting tested for fertility. So obviously they
Right.
have this question, if I get this varicocele procedure done, will my sperm count increase? Will my fertility issues be sorted? What would you say for that?
Yeah, so that's a very important question, and we do get a lot of people with the similar issues, and that is again because these men haven't got themselves evaluated previously. So once they're planning their family and then they go work up for infertility, that's where they picked up. So I would say that fertility is a multifactorial thing. It is not just a single factor that leads to fertility. But yes, varicocele is one of the reasons for that. So if you're suffering from difficulty in having in conceiving a child, so that is where a varicocele is diagnosed. So we should treat varicocele with the intent that at least if we remove one cause of infertility, we may be able to help you with your fertility issues. But to be honest, that doesn't mean that if we treat varicocele, we are promising 100% fertility afterwards, because a lot of it also needs to be seen how the sperm count is, how the sperm quality is. So a semen analysis is very, very important, and all these discussions have to be sat down with both the husband and the wife. Understand what are other concomitant factors that can or may be contributing to infertility, and step by step we remove all those factors. And if you're able to do that collectively, remove all the factors, and I don't see any reason why these men should feel that they may not ever be able to conceive. So that is something. And one thing definitely I would want to add, I would send this message across. So once we treat that, that psychological stress also goes away from men's mind, and we all know that psychological stress is one of the big factors that leads to that improved functions of sperms and everything. So that adds to that fertility component of yours as well.
Um, yes, doctor. I understand it's a very sensitive topic because when after marriage, the next step people look for is to, become parents, to conceive, and moment it gets dragged. So the first thing or the first question is raised only to a woman, and then a woman goes through certain
Right.
tests. It's now, I guess, with a lot more awareness. It's when the other male partner is also, brought along for consultation, where there's a combined evaluation is done, and the varicocele, if that is the reason, it comes out, and it takes even for our team a lot more convincing for them to even come to a doctor and see if alternate is possible or not. For such people, I'm sure, where
Right.
they thought surgery was the only option, this varicocele embolization, which you're talking about, is going to be a great relief. So, also wanted to know, yes, the outcomes, but is there any side effects to this embolization if they get it done? I'm sure they would want to know, because when you say surgery, there's always some
Sure.
side effects. But how, when it comes to this varicocele
Right.
embolization, is there any side effect?
Sure. So before I answer that question, I will just want to add to what you just said. I think real men are those who would not shy away from getting themselves tested along with their wives if they want to conceive. I think that is where the real manhood is. It's not to put the blame on the female partner, but to own up what you are going through. And I think the biggest deterrent for men was a surgery. See, it is as you rightly said, it is a sensitive part of the body, and somehow men have that thing about that their manhood is kind of related to their testes and everything. So people are do scared of getting that area cut by a blade or a surgeon. So I think that is something that this procedure totally does away with. So not just you need to be shy of coming with that problem, but the only fear that men probably had of getting a surgery done in this area is done away with this procedure totally. So I think now is the time that I think it's a world where we respect women equally, and I think men and women should walk hand in hand. And I think all the more
Absolutely.
important for female partners to encourage their male partners that in case they detect a varicocele in their male partner, they should encourage them. They should support them that these men should seek treatment and get themselves treated earlier. So coming to the second part of your question about the side effects. So to be honest, it's a very safe procedure. As I told you, there are no cuts. There is no general anesthesia. There is no nothing like cutting or anything. Only thing is that because we're going through a catheter and a wire inside the body, but that too we're in a venous system and a good experienced hands, there's hardly any complications regarding that. We do use some amount of ionic, non-ionic contrast, the ones that we use during normal routine CT scans. Hence, we want the kidney function test to be normal. So that is one prerequisite that before we embolize varicocele, we want these patients, these men, to have a normal baseline KFT test done, so that once their kidney functions are fine, there's hardly anything that's going to trouble them. Occasionally, some people, I would say one in a lakh, may have some small allergic reaction, but that is again something not in terms of troubling at all. We can just give some anti-allergics to take care of that. And I think it's a marvel in the sense that whatever side effects, whatever complications that surgery had, testicular injury, relapse, recurrence, long-term bed rest, I think is done away with this procedure. You go back home with a band-aid, that too no cuts in the groin, and you're able to resume your work from the next day onwards. And for all the sports people, for all the people who are very active, we encourage them to join their sports back within 3 to 5 days. So it is as early as 3 to 5 days you're able to come back to your total normal life.
Wow, that's amazing. I'm sure there'll be a lot of patients who are watching this will find a sign of relief, I'm sure. So I would like to, ask you if there's a small advice which
Right.
you would like to give the viewers, especially those men who've been diagnosed with varicocele and wondering, what should I do next? So what would be that piece of advice would you like to give our
Sure.
patients?
Sure. So one thing is, you don't have to worry if you have been diagnosed with varicocele. It is something that is non-sinister, a pretty common problem that a lot of men suffer from. So don't shy away. Seek medical attention. Get an ultrasound done, ultrasound Doppler, what we say, that will grade the varicocele. Know your non-surgical. Until that time, we are a good strong support, what we say as scrotal support, so that will keep your testicular veins under compression, and that would give you relief. Avoid a very heavy strenuous work. Avoid heavy weight lifting. If you are going to a
Okay.
gym, we recommend not to lift very heavy weights, because that will put a higher pressure on your scrotal veins and increase the varicocele grade.
Okay. And the very important thing, the moment they get to know, yes, they have some kind of a pain, they need to immediately visit us,
Absolutely.
visit the
Don't, don't
doctor.
don't shy away. I think
Yeah.
real men would not shy away, and I think we need to do away with that thing that मर्द को दर्द नहीं होता, दर्द होता है, उसे समझना भी चाहिए, and we should seek medical attention for early treatment.
Yes. And it's not always, if I have to speak on behalf of the men also, it's not necessary always we shy. It's sometimes, I guess, men being men, they always put certain responsibilities first.
Absolutely.
And
Absolutely.
in that bargain, their health always comes to the last.
Like,
So
absolutely. Absolutely.
that can be also a reason, if it not have to do with fertility, if it's just a pain which they are going through, they think, okay, let me adjust. That might not be the priority right now
Right.
because they will
Right.
have some other responsibilities going. But I think we all need to realize that only if we as an individual take care of our health first, we will be able
Right.
to take care of anything else which we always want to prioritize.
Absolutely. That's absolutely perfect and absolutely right, and totally agree with that.
Thank you so much, Doctor, for bringing in so much of clarity today. I'm sure this conversation will help many people who may be silently dealing with these concerns or have questions, but don't know where to begin. We
Right.
truly appreciate you taking the time to share your knowledge and experience with us, Doctor.
It was a pleasure, Samita. Thank you so much.
Thank you. And for those who are watching us today, if you have any questions or would like to understand whether a non-surgical option may be suitable for you, please feel free to reach us out. You can call the number mentioned on the screen or visit our website nosurgeries.in powered by Medac. Our team will be happy to guide you and help you connect with the right doctors. We will be also sharing many such more conversations like this. So stay with us on Before You Agree to Surgery series, and we will see you soon in the next episode.